Hello everyone, welcome back to Dentistry Tuesdays, and today's topic is root canals. Ouch and yikes. Before I get into this topic of root canals, please like and follow so you'll be notified about future content that I release. And if you're curious about all the products I highly recommend on a daily basis, please visit the link in my profile. Check out that oral care section to have the healthiest smile that you can. Now let's get back into it. Root canals. Whenever I recommend a root canal to my patient, I just see this horrific cringe on their face. It's just a natural reaction to the word root canal. Unfortunately, it can be a very, very painful process leading up to the diagnosis and recommendation of a root canal. And sometimes during that procedure, it can be painful. Now, why does your tooth need the root canal? There are several scenarios, but here are some of the most common reasons. The first scenario is typically there's a very, very deep cavity, maybe or maybe not has entered the pulp or nerve chamber of the tooth. Unfortunately, when this happens, the nerve dies and becomes infected, and typically is a very painful process. The second scenario is your dentist tried to save your tooth by taking care of and removing all that deep cavity in the tooth, but unfortunately the tooth has developed symptoms that is such that the nerve is dying or dead. The third common scenario is the tooth is cracked or fractured. The crack kind of enters the nerve or pulp chamber or gets very close. The nerve can't stand it and unfortunately starts to die and lets you know with pain as well. In all these scenarios, typically the tooth becomes infected, an abscess formation, some swelling maybe, and pus drainage can occur. That's when it's really, really painful. That's when typically the patients call us for help. So what does a root canal procedure entail? Basically, we drill a hole through the center of the tooth to gain access to the pulp chamber. Once we do that, we start to clean it all out, get the infected tissue as much as possible. We actually use household bleach to try to sterilize the chamber and the root canal systems. After we're done with that, we typically want to fill it and seal the tooth all the way down to the root tip. We do not cut off the root tip, basically. At the end, we just close up the access hole that we went through with typically some temporary filling material or sometimes more permanent filling material like tooth color filling or an amalgam or silver filling. Once we get rid of all the infected tissue as much as we possibly can, the body starts to heal and take over, the pain starts to go away, the swelling starts to go away, and thank goodness for our ability to heal. Because we can do root canal procedures, we're meant to try to save or preserve your teeth. This is also one of the biggest reasons why we don't do dentures anymore, because we don't pull out teeth as often as we used to. Of course, if you have any questions about this topic, please leave me a comment and I'd be happy to discuss with you further. Thanks everyone. Bye-bye.